So we may now sit down. So good afternoon. I am Jessie Claudio from the Development Studies program of the School of Social Sciences, Ateneo de Manila University. I will be your host for this afternoon. You may access the program flow and the conference abstracts through the link and QR code flashed on the screen right now. So maybe we can flash the QR code and the link, yes. So to formally open this event, let us hear from the leaders of the two universities. May I first call on Father Roberto C. Yap of the Society of Jesus, President of the Ateneo de Manila University, to give his opening remarks.
Dr. Lani Hartanti, Vice Rector of Universitas Katolik Widya Mandala, Surabaya, Dean Bopip Akpeduno, Dr. Diana Mendoza, our colleagues and students from Ateneo de Manila, and colleagues and students from Universitas Katolik Widya Mandala, Surabaya. Good afternoon and welcome to Ateneo de Manila University. Widya Mandala comes from the ancient Javanese language, Widya, which means knowledge, and Mandala, a place or building. So Widya Mandala can be interpreted as a place for scholars, a place where knowledge thrives. We are very grateful to be in this learning space this afternoon. So whether you are here at Escaler Hall in the Ateneo or East Theater, Pakuan City Campus in Indonesia, today is a confluence of knowledge, cultures, shared experiences, and identities. Education is a powerful engine to effect change and solve complex real-world problems. And as universities, we have an opportunity, perhaps even a responsibility, to use our strengths and amplify our voices to be forces for the common good. And we can do that by being open to initiating dialogues and fostering collaboration and innovation. Throughout our school's history, we have built and strengthened many bonds of collaboration with educational institutions across continents. Today, I express my gratitude and respect to Universitas Katolik Widya Mandala Surabaya for this opportunity to engage and collaborate. We may have come from different backgrounds and have other languages, but we have a shared passion for learning and nurturing our ASEAN roots. As educational institutions, we must ensure that our spaces of knowledge and wisdom are open to differing opinions and perspectives, but also embrace finding common ground to forge substantive conversations for the good of our ASEAN family. In this way, we speak the same language. Ateneo de Manila has always been and will continue cultivating a culture of diversity, inclusivity, and sustainability. On behalf of Ateneo de Manila, I pray that the bonds we tie today will flourish for the betterment of our institutions, nations, region, and the world. May this space of knowledge and wisdom inspire us to reach new horizons in the service of God and others. Thank you, and I wish you all a productive conference. Good afternoon.
Thank you very much, Father Bobby. Now let us hear from Dr. Lani Hartanti, Vice Rector of Student Affairs, Planning, Development, and Cooperation of the Widya Mandala Surabaya Catholic School.
Honorable speakers, honorable lecturers and students from ADMU and Mandala University. Good afternoon and on behalf of our rector, please allow me to express our gratitude and joy to be here and witnesses the joint student conference with the vital health challenges and opportunities in the Philippines and Indonesia as the first activity of collaboration between Ateneo de Manila University and Surabaya Catholic University. As an institution dedicated to student-centered learning, the Mandala Surabaya Catholic University has sought ever more inspiring, instructive, and creative ways to further better the educational and development of students. But in a globalized world like the one we have today, one can be willing to have accepted one's utmost in this endeavor without opening the students' horizons to the insightful ways of thinking of their fellow students in the other parts of the world. In this regard, we at Widya Mandala Surabaya Catholic University established this Memorandum of Understanding with the Ateneo de Manila University with great joy in our hearts. We are very grateful to the openness and willingness of the Ateneo de Manila to share this educational journey and adventure with us, and we look forward to the many different activities that will be organized to make this educational adventure a reality. Thank you very much, and I wish you a fruitful conference.
Thank you, Dr. Hartanti. Now, we look forward to hearing from our Indonesian presenters this afternoon. And to kick off this afternoon's conference, the Ateneo Initiative for Southeast Asian Studies, or ICS, of the School of Social Sciences, Ateneo de Manila University, proudly announces the collaboration with the Widya Mandala Surabaya Catholic School in Indonesia. This collaboration between the two Catholic universities in the ASEAN will be formalized today as Ateneo President Father Roberto Yap and Widya Mandala Vice Rector Dr. Lani Hartanti present the signed Memorandum of Understanding between their respective universities. Preparations for the partnership started in April this year during the International Symposium on the Global Solidarity Crisis held in Widya Mandala, where Dr. Dennis Batangan of the ICS presented a paper entitled Dilemmas in Health Information Technology and Decision Support Adoption. The MOU aims to promote global learning for the empowerment of their faculty and the bolstering of educational opportunities for their students through the following future joint activities. First, visits by and exchange of graduate and undergraduate students for study and research. Second, visits by and exchange of faculty members for research, teaching, and discussions. Third, visits by and joint administrative professional development. Fourth, exchange of information, including but not limited to exchange of library materials and research publications. And lastly, joint research and academic activities. At this point, may we request Father Roberto Yap of the Ateneo de Manila University and Dr. Lani Hartanti of the Widya Mandala Surabaya Catholic School to proceed with the formal presentation of the signed Memorandum of Understanding. So may we ask Father Bobby and Dr. Lani to show the signed document. Thank you, Father Bobby and Dr. Lani, for joining us this afternoon. Because we cannot be together in one venue for this event, we have prepared short videos or virtual tours to introduce the two universities to our student and audience. So please play the video.
Life is a journey that leads us to a choice. Your choice determines your future.
In this era of globalization, we need to be competitive.
But it is not just about competing.
We need to be creative.
And innovative.
To be truly unique. As we look to find ways to meet the challenges
that lie ahead. We have always been taught to care,
Caring is an attitude that teaches us
to respect ourselves and to respect others.
by caring, we are able to find solutions to the problems we see in our world today.
We are also taught to always be creative.
By being creative, we are able to think out of the box. By being intelligent and creative, we expand our imagination
To create things that can be enjoyed by everyone.
We're also taught what it takes to become a leader in our world today.
A leader who can transform self
Into character.
True leaders are able to build
and develop the organization we require. We also learn to be leaders who are willing to listen, who can be sensitive to our surroundings.
By putting others ahead of our own ego.
We are social beings who truly care to love
And respect one another.
and devote our future careers
in our service to others
as well as our service to God.
We never know what type of impact you may have on other people's life, either by your action or your lack of action. That is why in this campus, we are striving for excellence, doing our best, even beyond the call of our duties, even to make sure that you may improve the quality of life of the community. That is what a life-improving university is all about.
I've made the choice. I've chosen the right place on my own. Widya Mandala, a life-improving university.
Hello, I'm Father Johnny Go of the Society of Jesus. I'm the Dean of the new Gokongwei Brothers School of Education and Learning Design, where we don't just teach old school.
Welcome to a world driven by knowledge and technology. Welcome to your future. Welcome to the School of Science and Engineering.
I hope you will join us soon in our dynamic and productive academic community. Welcome once again to the School of Social Sciences, to our 6 departments and 6 programs.
I'm happy to invite you to spend your college years at the School of Humanities of the Ateneo de Manila University.
Welcome to the John Gokongwei School of Management, or JGSOM, the Center of Excellence in College Business Education.
I invite you then to be part of our vibrant Loyola schools.
Again, welcome to Ateneo, and we hope to see you around campus virtually for now and hopefully physically very soon.
Okay, so we hope you enjoyed those videos and you're looking forward to going physically into these universities. No? But now let us now proceed to the student conference. So let me call on our moderator for the first set of presentations, Dr. Leslie A. Lopez, Program Director and Assistant Professor of the Development Studies Program.
Okay, good afternoon, everyone. Apart from facilitating mutual friendship and academic cooperation between Widya Mandala Surabaya Catholic School and Ateneo, this event also hopes to create a student-centered discussion on ASEAN-related topics that aim to strengthen the people-to-people connectivity among the ASEAN member states. We have invited select students from the two universities to present excellent papers on various regional health concerns. In total, there will be 6 student presentations this afternoon, 3 from the Philippines and 3 from Indonesia. We will start with the Philippine presentations first. Each group is given 10 minutes to present their paper. For the first presentation, may we all welcome Ms. Beth Anne-Marie Thieu, who will present her research entitled HIV/AIDS, Stemming the Roots of the Epidemic Through Education.
Hello and good afternoon. Magandang hapon, salamat siang to everyone here. Today, I'll be sharing with you my work on a health issue that has long plagued the ASEAN, the HIV/AIDS epidemic. I'll be discussing the role of education as well as how we can use it to stem the issue of HIV from its very roots. Next slide, please. To guide us in this presentation, here is how our discussion will flow. We begin by looking into what HIV is, the current context and relevance, and some policies in the ASEAN to give a more data-backed perspective. We'll look at recent performance and also discuss some relevant recommendations in the end. Next slide, please. For this event, I hope to raise a sense of urgency towards this ASEAN-wide epidemic as it continues to grow and threaten the Southeast Asian region as well as our home country, the Philippines. I will be sharing some current trends and information about the virus as well as how COVID-19 plays into the picture. We'll be focusing on the largest HIV group as they need our utmost support. Moving on, let's start with some quick facts and impacts surrounding HIV. Next slide, please. HIV is an immune system disease that affects white blood and CD4 helper cells. It makes those infected more susceptible to infections like tuberculosis and cancers like lymphoma, which grow more deadly if HIV is left untreated. It has no cure available, but prevention medications like pre-exposure prophylaxis and medicines to minimize the viral levels of like antiretroviral treatment are available, although these come at very costly prices. Moving on to the next slide, let's cover some misconceptions. There are often misconceptions about how it's transmitted, but based on clinical research, it is not transmitted through saliva or skin-to-skin contact, but through unprotected sex, which accounts for 56% of new global infections, as well as the illicit sharing of drug needles. Though transmission risks are about a small 1%, we need to remember that HIV's impacts are irreversible. Like with many diseases, environmental factors contribute to HIV spread. Those who are challenged socioeconomically are placed in situations of financial difficulty and low education levels, which increases the risks of substance abuse and unsafe transactional intercourse, which is often done for money. This is worsened by social stigmas against people living with HIV, or we can call them PLHIV, plus the ASEAN-wide taboo of speaking on sexual education as well as HIV-related topics. Moving on to the next slide, we see that there are over 1.7 million people in the ASEAN as of 2021, with men who have sex with men being the fastest growing HIV group and comprising 53% of the total population. ASEAN countries have implemented various programs to curb its spread, and as a result, the region saw a 21% decrease in transmission as well as a 56% decrease in deaths between 2010 and 2020. Although if we look into individual state performance, we see another story. Indonesia, Singapore, and Thailand have shown great successes in lowering infection rates, whereas Philippines and Malaysia have struggled to keep the numbers low. Current progress against HIV is also threatened due to mass government focus on COVID-19 in ASEAN member states like Indonesia and Cambodia. So moving on, we ask, what can we do and where can we start? Well, we can look to HIV education. This path of intervention involves general sex education and topics on HIV prevention and management, like the use of contraceptives and STDs. We need to prioritize this approach because it is more efficient compared to treating HIV after it has already been contracted. And it also stops HIV from the very roots by encouraging safer, more conscious sex practices. Speaking on macro impacts, HIV education helps us maintain our workforce numbers and health, and keep the ASEAN on a steady path towards economic development. Moving on to the next slide, and now that we know how dire the epidemic is, as well as how education can help us, let's look at a few policies from different countries and find some ASEAN-wide issues. We'll narrow down the discussion by focusing on their impacts on this particular MSM group. Let's focus on the Philippines and Thailand, two countries with opposite trends in infection rates. The Philippine RA 11166 sets the foundations for HIV/AIDS support and has both government agencies and civil society organizations, we can call them CSOs, to provide HIV education and services. Thailand, on the other hand, has its Ministry of Public Health leading their national AIDS strategy, aiming to reduce infections by 85% and HIV discrimination by 90%. They also have their own dedicated HIV education program to lower risk behaviors and infection rates. Moving on to the next slide, we take a more critical lens and we see that both of them have their own pros and cons. They take a holistic, multi-sectoral approach to HIV education and prevention, as well as non-discriminatory policies towards all PLHIV and service delivery. Both countries have their own dedicated HIV programs and plans to ensure that goals are met, but they also come with their own challenges. Thailand's strategy is well implemented, whereas Philippines' plan is slow-moving due to a lack of resources and uncoordinated implementation. As a result, only a small 25% of Filipino MSMs actually have comprehensive knowledge on HIV prevention. Stigma and discrimination continues to be a problem for Philippines, Thailand, and also for Indonesia, with MSMs in these countries growing less likely to seek HIV services because of the stigma and discrimination that they face. Moving on, the COVID-19 pandemic has also made the fight against HIV even more challenging. Here we have data from 2018 to 2020 by UN and AIDS, the United Nations HIV/AIDS Agency. Although we see a rise in HIV testing and awareness, condom usage and the coverage of HIV prevention programs dropped sharply, leading to new infections in these countries. MSMs are also pressed to find support during the pandemic. Further research also shows that despite initiatives dedicated to HIV education, there is still a lack of prioritization here. Governments across the ASEAN often focus on more pervasive health issues like COVID-19 that affect the larger majority of the population. Moving on, and with these challenges, how might we move forward? How do we address the needs of our PLHIV and MSM as we move into the new normal? Next slide. First, we need to remember that MSMs grow not only in their numbers, but also younger in their exposure to risk behavior, threatening them and also their community's health. To build on our current progress, we need to look to successes like Vietnam, who use mobile technologies and social media to improve HIV service delivery. We need everyone to be involved, from CSOs, governments, to the general public. We need to be open and understanding towards our PLHIV and see that they are more than their condition. They are people and they are a part of our community. To move us forward and moving on to the next slide, my research has led me to these recommendations, key tasks, and KPIs. First, we need to achieve good coordination between the government at all levels and CSOs. We need to motivate our governments to prioritize HIV education as they hold the most power in rounding up our resources and manpower. We also need to empower CSOs and healthcare providers with the necessary resources to reach MSMs and to give them roles in developing budget proposals to strategic plans for HIV education programs alongside our government agencies. Second, we need to improve HIV education and awareness among healthcare providers and the general public through educational programs and medical resources. We need to establish respectful, understanding behavior towards PLHIV to motivate them to seek medical support and to lower the spread of the infection. The public can also benefit from informational initiatives like talks, performances, social media campaigns, which can significantly reduce stigma and discrimination towards MSMs and PLHIV. Lastly, we need to reach our target population by raising their levels of HIV education enrollment. We want to encourage a culture of good sexual health management among MSMs. For this, we need close collaboration between CSOs, health institutions, and the private sector to create apps, websites, and MSM communities or organizations to help in providing HIV education directions for HIV health services, and to overall just create a safe space for MSMs to manage their health and discuss it. Altogether, we should see a decrease in infections and discrimination, a rise in health-seeking behavior among MSMs, and an overall increase in prioritization within the government towards this topic. Moving on to the next slide. And although the global goal of achieving zero HIV infections and deaths by 2030 is indeed ambitious, we need to remind ourselves that regardless of culture, all human life and health remain at the heart of social development and progress. Let's do our best to make sure that it remains our utmost priority. Thank you all for listening, and that concludes my presentation.
Thank you very much, Beth. Next to present the group working on the research, The Road to Improve Universal Health Coverage in the ASEAN region, composed of Ms. Danica Petilla, Mr. Dieter So, Ms. Augustine Iala, Mr. Jacob Abalos, and Mr. Pedro Balisi. I will also be calling all the presenters later on for the open forum, but for now, let us listen to the group of Ms. Petilla.
Hi, I'm Danica Petilla, and with me is Ino Iala, and our presentation will be about universal health coverage, in short, UHC. So this is one of ASEAN's common challenges with regards to health, and although some ASEAN countries have made progress towards it, many have yet to successfully implement it. So ASEAN Member States, in short, AMS, especially the developing countries, needs reforms regarding how to approach UHC. So what is UHC? Universal health coverage is when all people have access to the health services they need, when and where they need them without financial hardship. The application of such policy brings relief and security to its constituents by allowing them access to quality healthcare that a state's constituents can readily avail of at almost no or minimal expense. However, as it is a cross-cutting issue with multiple building blocks reliant on various sectors, the road to good quality universal healthcare was proven to be challenging. Now we'll be talking about some of the barriers that hinder the provision of UHC. So what makes it difficult to achieve first is affordability. Implementing UHC can be quite expensive, especially for most member states that are categorized as developing countries, including the Philippines. Due to the high expense of implementing UHC, these low-income countries struggle to fund it. In the Philippines, we remain reliant on private spending, and with limited funding from public organizations, we suffer from limited health financing as a whole. Another barrier is shortage in supply, not only in production, but also in the labor force. Some AMS, particularly the Philippines, lack good quality medical infrastructures, resources, nurses, and vaccines. Within the first year and a half since the pandemic started, around September 2021, Singapore's vaccinated population was at 79.63%, Cambodia at 78.9%, Taiwan at 55.52%, Laos at 40.43%, Indonesia at 32.96%, and the Philippines only at 25.07%. If herd immunity is set to 70%, this suggests that the Philippines is extremely lagging behind, but also that there is an uneven progress between the ASEAN states. Perhaps there's a need for these countries to enhance their supply chain capacity to avail all the necessary assets to efficiently provide the people with the healthcare they need. With that being said, there are policies, or perhaps there being none, that are making it more difficult to achieve universal health coverage. For instance, lack of funding for R&D. ASEAN member states like Singapore, Vietnam, and Malaysia have the potential to be leading manufacturers and developers of biotech companies that produce medicines and innovative solutions for the health sector. However, some of these countries lack funding and investment, so they only often focus on increasing the number of hospitals instead of focusing on efficient resource mobilization for faster services or providing quality healthcare to actually lessen illnesses. And this highlights the need for more clear guidelines and frameworks from the ASEAN on investments that can be used to fund research and development without compromising the need to set up medical facilities. Another issue is that the ASEAN has not been able to create strict policies or legal action to increase government spending on healthcare. From the World Bank data in 2019, the Philippines' healthcare expenditure as a percentage of our GDP was only at 4.08%. While they have created recommendations that some countries like Singapore have adapted to increase their overall budget, not all have done this, and there has been no policy or agreement among the AMS that supports this. If government can't afford this, they can look into other government reforms like structuring or budget allocation, because it will be difficult for all true and meaningful change to come solely from the private sector. But also, it's the government's responsibility to protect and advance the interests of society, including the provision of high-quality healthcare. Now I'd like to introduce Ino Iela to present the policy recommendations.
Okay. Thank you, Danica. So given the current state of UHC, along with the current context of the policies, we now would like to present the ways we believe AMS can move forward in providing universal healthcare. It is recommended that the existing policy be altered to take into consideration the short-sightedness of it to reach a more holistic and balanced approach in the creation of such policies. The main elements considered in crafting the said recommendations are finding a means to balance the investments of the private sector towards both facility creation and maintenance that respond to current and immediate needs, with research and development that aim to create long-term solutions and progress. This will allow the private sector to serve as a pillar for the healthcare programs of countries, not only in terms of reaching the needs and demands, but also of planning ahead. It puts countries in a better position to respond to present-day needs while simultaneously working to approach future challenges. Moreover, investment from the private sector could also be poured towards human capital development, an aspect of healthcare which is as important as infrastructure to help better equip healthcare professionals with the skills that they need to provide for a higher quality of care. In the Philippine context, there has been progress made with regards to private facilities and funding that is generated, but more strides can still be made in research and development, and especially with managing human capital. The Department of Health has been concerned over the exodus of healthcare workers, like nurses who commonly seek greater opportunities abroad. This puts the already vulnerable healthcare system in an even tougher position. It's critical but very challenging to balance all three aspects to be able to respond to needs and provide holistic healthcare. Through balanced investments in facilities and medical needs, research and development, and human capital, countries will hopefully be able to take steps towards a more effective, efficient, and comprehensive UHC. This improves not only the availability of healthcare through an increase in facilities, but also a greater quality of it through R&D carried out by a more competent and well-trained workforce. This will, however, require clear opportunities and expanded frameworks to serve as a guide for the countries in carrying this recommendation out. The innate goal of universal healthcare is access to quality healthcare that the state's constituents can readily avail of at almost no or minimal expense. Given the context of the current landscape, along with existing policies, we recommend a more comprehensive and holistic approach from the private sector in terms of investments. This policy recommendation to alter the focus of investment towards medical infrastructure derived from government and private sector cooperation towards a more comprehensive investment into the entire healthcare system is much more aligned with the paramount goal of universal healthcare, to provide the people for a better quality of life. Thank you very much.
Last but not the least, we have Ms. Ria Chong, Ms. Rafael Isunga, Ms. Pauline Salangsang, Mr. Hans Wong, Mr. Miguelito Yamamoto, and Mr. John Sorbito. They will present their paper on the role of information, education, and communication in mitigating HIV/AIDS impact among ASEAN member states. Let us welcome the group.
So, magandang araw or salamat pagi in Indonesian. So, here's me and I'm Hans Wong, and here are my group mates from my immediate right to my rightmost. So, James Zerbito, Aika Salangsang, Miguel Yamamoto, and Ria Chong, and Pai Isunga, who's not around with us. And today, we will be presenting our policy memo on the role of information, education, and communication in mitigating HIV and AIDS among ASEAN member states, or AMS, as I'll be calling later. So, as we all know, HIV and AIDS continues to be an alarming issue. Oh, next slide, please. Yes. Next slide. Yes, there you go. As around 1.7 million people have contracted HIV, according to a report by ASEAN last 2016. So the stigma and discrimination against HIV and AIDS positive patients are prevalent in the communication interventions. Moreover, the budget allocated for HIV treatment also differs among the AMS. As of 2016, actually roughly half of the ASEAN member states, namely Vietnam, Indonesia, Myanmar, Philippines, and Thailand have allocated these funding for HIV. And also, why is it very important? Next slide. Yes. The importance for this one is because a variety of demographic groups are at risk of developing HIV. So these are the men who have sex with men, or the MSMs, as we've called, and then the persons who inject drugs, or the PWIDs, the transgender individuals, sex workers, and migrant workers. So if their conditions are left untreated owing to a lack of legal protection, insufficient means for treatment, and the existence of the stigma, the affected population runs the risk of a more debilitating virus called the AIDS virus. And moreover, for the critique of policy options, I would hand this platform to Ria Chong. Let's go, Ria.
So HIV prevention and care in the ASEAN region has seen significant progress, which may be attributed to rigorous HIV mitigating programs that not only increase the awareness of HIV, but also normalize preventive measures. However, structural barriers in countries like Cambodia, Indonesia, and Myanmar, as well as sensitivity surrounding sex in more conservative AMS like Brunei and the Philippines, pose a challenge in broaching the issue, pursuing IEC interventions, and fully implementing policies. To further concretize the issue surrounding HIV, we will be critiquing existing policy options across AMS, beginning with the Philippines. Next slide, please. Okay. So the RH law and AIDS law provide free condoms and mandated age-appropriate sex education. However, these current policies don't effectively support health-seeking behaviors and information dissemination. So for instance, the curriculum included mere explanations of human reproductive functions, resulting only in 20% of the population being able to identify HIV prevention measures and misconceptions. These lapses are further compounded by the reluctance of the church to sex education and the government's reduction of budget for family planning. Meanwhile, for Indonesia, from our research, Indonesia's dedicated efforts on scaling up HIV-focused health services relied primarily on revising service standards for health and releasing the ART acceleration plan. Other efforts included expanding to 9,000 health clinics where provider-initiated testing and counseling, or the PICT, encouraged voluntary response from target populations. There were also notable changes in health service delivery models, payment mechanisms, and treatment response reprioritization. However, declining financial support and increasing service demand restricted the government from mobilizing necessary domestic resources. For other critique policy options on other AMS, allow me to introduce Miguel Yamamoto.
To add a bit more insight, let's look into the policies of other AMS. In Brunei, HIV surveillance is done through routine screening among antenatal patients, prisoners, and drug users. However, laws prohibiting homosexual acts and other related sex practices make high-risk populations difficult to target. In Cambodia, rapid HIV testing is conducted through voluntary confidential counseling and testing, or VCCT. Pre-test counseling provided information on the implications of results, while post-test counseling detailed the disclosure of HIV status and referral to the access of VCCT. However, progress is hampered by the lack of coordination between various NGO players. In Myanmar, HIV intervention plans take a more strategic direction on impact mitigation. Approaches to treatment, medical care, and support are all integrated into upscaling its health systems and self-testing initiatives. However, guiding principles on national response are currently being anchored on community participation and accelerating township involvement. Now for the policy recommendations, let me introduce to the stage JM Zorbito.
Thank you, Miguel. As evidenced by our critique, the AMS's HIV intervention plans and policies currently face political, social, and structural barriers towards their implementation, which calls for their review and amendment. Due to the nature of these plans, which actually overlap and contain shared practices such as voluntary counseling, a collaborative approach among the AMS is necessary. By doing so, they can share and guide each other in successful strategies for policy implementation in their local contexts. The collaboration of other stakeholders such as sectors, key populations, and medical partners is also vital in order to have a better response towards HIV, as this could even empower and allow individuals to make independent and better informed decisions through the fruits of their collaboration. To further achieve this vision for HIV policy reform, let me introduce Aika Salangsang to promote some IEC interventions.
In addition to policy reforms, IEC interventions may be key to filling in the gaps and improving the ASEAN Member States' current policies. The AMS can take inspiration from the Empowered Teenagers program in Singapore, wherein rehabilitated drug users and medical professionals conduct in-class lectures to increase students' knowledge on HIV. Educational institutions that can make IEC campaigns mandatory and engaging for students may wish to expand into interactive seminars on HIV symptom recognition and the stigmatization of HIV misconceptions. To address the lack of HIV knowledge, similar seminars can be held in the workplace and in community villages. This creates an immediate sense of urgency for HIV testing. Furthermore, the coordination between local authorities, public health, and regulatory agencies is essential for the planning and execution of seminars and programs. However, interventions must adhere to the standards established by the ASEAN Qualifications Reference Framework, which seeks to put the educational credentials of each AMS member state on a more level playing field. In order for these types of initiatives to be successful, discrimination and stigma against drug users must be eradicated. In the Philippines, for instance, these initiatives would be best led by the Department of Health and the Department of Education. Public opinion about PWIDs may be swayed in a more positive direction if social media campaigns are successful in reducing the stigma associated with them. According to data from GWI, citizens of most Southeast Asian countries spend over 7 hours per day using the internet, which includes social media platforms like Facebook and TikTok. These apps can facilitate the dissemination of HIV-related information, such as warning signs of drug use, who to contact in the medical system, and what programs are available to aid PWIDs. The AMS can ensure these policies are implemented by setting up conferences and progress reports at predetermined intervals, where successes and failures are to be discussed. In order to compare their progress to that of the other ASEAN member states, they may decide to come together and align on common metrics to use. Last but not least, transparency must be upheld in terms of budget reports for these initiatives, detailing not only where the funds go, but also how much is used and how much is saved. For our conclusion, I hand the floor back to Hans Wong.
Thank you so much, Aika, for presenting our IECs. So this is our conclusion. So to conclude everything that we have presented, we have actually identified 2 barriers evident to HIV awareness across the AMS. So first is the stigma and discrimination against PWIDs and HIV patients. And second is the insufficient education and unawareness of the HIV disease as itself. So in order to reduce the impacts of the present stigma on the PWIDs and HIV patients, so the first is really to revisit the existing HIV-related policies and the establishment of IEC efforts, as what Aika has mentioned. And second is to involve the collaboration of several stakeholders to provide assistance to other AMS. And finally, to encourage accountability, transparency, and initiative implementations across AMS. So we sincerely hope that the AMS continues to educate, inform, and communicate HIV and AIDS awareness and also the mitigation policy to all the AMS countries. Thank you so much. This is our presentation.
Thank you very much, Ria, Rafael, Pauline, Hans, Miguelito, and John Mark. Now we are privileged to have with us Miss Anastasia Jessica Adinda Susanti. Anastasia Jessica is a lecturer at the Faculty of Philosophy, Widya Mandala, Surabaya Catholic University, Indonesia. Currently, she is also a PhD student at the Doctoral School of Philosophy, University of Szeged, Hungary. Her research interests are in the philosophy of art, media, and visual culture, which is very timely considering that many of the policy recommendations that we have today is pertaining on social media. So without much further ado, let us all welcome Ms. Anastasia Jessica. You have 15 minutes for your reaction to the Philippine students' presentation.
Thank you, Dr. Lopez. So, good afternoon, everyone. Thank you for having me. First of all, I would like to say congratulations to all authors and for their presentation and also their papers. So today I'm here to give remarks, comments, and questions to authors of the papers. Let me begin with the first presentation entitled HIV/AIDS, Stemming the Roots of the Epidemic Through Education. This paper highlights the cultural and political aspects that need to be considered in HIV education. I think this disposition goes hand in hand with the assumption of the holistic theory of health that posits a person is healthy if and only if he or she has the ability to attain their vital goals. In other words, someone cannot be healthy without the external social and structural conditions that allow him or her to live a healthy life. And another key point is the author suggests 3 priorities in policy recommendations, namely motivate government prioritization and coordination efforts towards HIV education and other services. Secondly, fast-track implementation and improve the quality of HIV education and awareness. And then lastly, to raise levels of education, HIV education, awareness, and enrollment in preventive and treatment schemes among target population, that is MSM. I would like to elaborate a little bit on the third priority, which is about the way to raise levels of HIV education and awareness through developing apps and websites. As we know, Asia is paving way for digital healthcare system. For example, in China, for example, there is a healthcare app that allows user to see doctor online rather than waiting for hours at hospital. In Indonesia, we also have Halodoc website, which has emerged as one of the largest platforms for patients to easily access the general practitioner and then making teleconsultation, pharmacy delivery, and home lab services. And it helps the country, it helps Indonesia to overcome the lack of easy access to primary care. My question is there any possibility to develop the digital healthcare system to serve primary care, for example, for teleconsultation or telemedicine, and then e-pharmacy or monitoring health for long-term period, both for people living with HIV and non-HIV. So my question is there any possibility to develop these apps? Is there any possibility to make app or website maybe that can help both for people with HIV and non-HIV? Secondly, I would like to give remarks on the paper entitled The Road to Improve Universal Health Coverage in the ASEAN region. As the author mentioned, Asian countries are facing many difficulties, many challenges in healthcare system. Among them are firstly financial constraints, including low levels of government spending on health and healthcare. And then secondly, supply constraints, which is inadequate numbers and densities of health workers. And one of the priority in the ASEAN health sector is to strengthen the health system and access, and this goal need to be achieved between 2021 to 2025 frame time. However, we know that there is a wide social and economic gap between Asian countries, let's say between Indonesia and Singapore. And my question is the policy that the authors suggest can narrow this economic gap between Asian member countries? So eventually all member states or member countries have their own universal health coverage. So can this policy that the authors suggest can narrow the social and economic gaps between the Asian member states? And if so, how does it work? And secondly, also in the paper, the author suggests a policy reform that regulates the collaboration between the government and the private sector to pour investment not only into infrastructure, but also into other aspects of healthcare, such as in research and development, as well as human capital development. My second question is, because this policy involves private sector, how to avoid the excessive private benefit over the social benefit? So we know that usually private sector investment aims to make money, to earn profit. And this is contrast with the universal healthcare system that has purpose to not to earn private profit, but to develop the social benefit. So how to avoid the private profit over the social benefit? And thirdly, I would like to comment to paper entitled A Policy Memo on the Role of Information, Education, and Communication in Mitigating HIV/AIDS Impact Among Asian Member States. The authors highlight the comparison of HIV prevention and care policies between Asian member states and find some shared practices of HIV prevention among the countries. For example, encouraging voluntary counseling and self-testing initiative. Also, the authors suggest adopting a collaborative approach in policy reforms, as well as broadening the information, education, and communication of HIV prevention, informal education, community, and social media. My question is, what could be the challenge for this collaboration action between the member of ASEAN to share their existing practices and HIV prevention? So what could be a challenge in this collaboration? I think this is all that I would like to say. Thank you all for listening.
Thank you very much, Ms. Anastasia Jessica. Now, may I invite all the paper presenters to please sit up front. And I would like to open the floor for questions and comments regarding your presentations. May I invite all the presenters to please sit here on the table up front. Beth, Ria, Rafael, and Danica, members of the group, can I invite you to please come over? So there's actually already a number of questions that were posed online, and also as pointed out by Ms. Anastasia. So let me get started with that. Okay, chop chop, come on. Okay, so are all the groups here now? Second and the third groups are all represented? Okay, let me start first by the question that was raised by Ms. Anastasia regarding the group who talked about the HIV/AIDS. One is that I think, and this applies to both groups, the group of Beth and also the group of Danica. Given that each AMS already have their own systems in place in terms of combating HIV/AIDS, what would it take for them to collaborate with one another so that they would have a more regionalistic approach in combating the disease? That's one question. And then the second question is more primary. Father Ramon Nadras actually raised the issue whether why are the groups focusing on HIV/AIDS? Is it really a top health concern compared with the other diseases and sicknesses that are around us in the ASEAN region? So those two questions, and any of the members of the two groups may start answering them now. So would you like to get started, Beth? And then I'll call on the next group. Sorry.
Hello, I think I'll be able to answer the second question and address whether or not, or address why we're emphasizing and focusing on HIV specifically. So in terms of numbers, HIV falls on the lower side compared to a lot of other diseases. But in my presentation earlier, I wanted to emphasize that unlike other diseases, there are very few of them that actually have no cure, and one of those. And the choice of the focus for this issue is it came from the place where, in the discussion where HIV discussion, or basically any coverage on the issue, has gone low or gone really low because of COVID, since the entry of COVID. And since then, HIV has actually gotten really rapid. The growth of the infections has gone really rapid then. Perspective, rather than focusing solely on the numbers, I thought it would be more important to focus on a sickness that has been forgotten. And I just wanted to put it back here in the picture, re-emphasize how important it is that we should be focusing not just on the numbers, but ensure that all health for everyone is emphasized and achieved. And that's my answer.
Thank you so much, Beth. May I call on the group of Danica, Dieter, Augustine, Jacob, and Pedro? Yes, the group of Danica. I'm sorry, Ria, Rafael, and Pauline.
So initially, during our stage or like planning of our policy memo, we looked into the health sector actually in ASEAN in general. And from what really stood out was the prevalence of HIV and AIDS. And it's what made us choose it. And even though there are other possible diseases or sicknesses to choose from, we believe that or observe that HIV and AIDS is the one that has been neglected. And there's also different cultures in the AMS, which also what was prevalent among them is the discrimination and stigma against the HIV and AIDS. So that is one of the reasons also on why we focused on HIV.
Okay. Thank you so much. So please, if you have questions from the members of the class who are present on site, you can just approach the mic strategically located in the room. Now I would like to point out a question for the second group, the group of Danica who talked about the UHC. This is actually the question that's posed by Ms. Anastasia, that one of your policy recommendations is talking about private-public partnership. But how would you temper the profit objective of the private sector such that the social goal of this partnership is not lost in terms of providing quality and accessible healthcare to the population? Anyone from the group may answer.
Hello. So I think 3 points go into this question. I think the first is to recognize that even in healthcare, the monetary aspect is still an important element. And when you look at the Department of Health, a large reason why there's been this exodus of nurses and healthcare workers is because they aren't able to be provided with the benefits that they can get from other opportunities. And so it's recognizing that, yes, primarily it is to provide healthcare, but there is still an important layer there because they are workers and it is their career as well. Second is to really understand it is a collaboration. It is a partnership of private and public. And so the private sector is integrating into these healthcare systems that have already been here for a while and trying to enhance and improve it and not totally overhaul it or to be self-serving in that way. And I think third is recognizing that funding is also important in other aspects and elements. An example of which is education and research and development. I think a lot of funding recently has been poured into schools and universities and institutions, and that indirectly also helps the healthcare system with the advancements in technology and research and knowledge that we are able to provide from the schools moving forward.
Okay, there's actually a question that is connected with that previous question. Because in the UHC, we all know that the implementation of UHC is contingent on the availability of health financing. And given that there is like runaway inflation globally, what is a singular recommendation that the group can come up with so that in terms of prioritizing the programs of ASEAN member states post-COVID-19, the quest for a truly working UHC will not be lost in the process?
Given the inflation and
Yes,
economic
given that money is needed in the implementation and that the pie is very small, what are some of your policy recommendations so that UHC will remain at the forefront of government and the AMSS programs despite the emerging competing priorities?
I think it might not be a recommendation, but something that institutions can start to understand is that better healthcare programs do lead to better economic results of countries. Based on research on OECD Observer, it was studied that a 10% increase in life expectancy leads to a 0.4% increase in economic production of that country. And so investing in healthcare is not taking steps back from the economy, it's indirectly complementing what we're trying to do because a greater healthcare system will lead to more productive citizens, both physically, mentally, and emotionally. And those citizens are what provide for our GDP and our GNP. And I think a more resilient healthcare, we've seen it time and time and again in the pandemic. Those countries that can't seem to bounce back are the ones that have a vulnerable healthcare system because that's when lockdowns are prolonged and lockdowns lead to businesses closing and institutions losing money. And so I think before any recommendation is made, it's important for the healthcare sector, the business sector to understand it's not mutually exclusive, it's not counterproductive. Investing in healthcare does lead to economic growth. And I guess for the actual recommendation, we could look into greater collaboration, even across countries, and not necessarily contain it within a certain nation, but for those countries that are more advanced, like Singapore, and who are willing to invest, that there can be greater agreements and collaborations that ASEAN can facilitate.
Okay, thank you very much. So you just highlighted the importance of educational institutions like the Ateneo in educating the people, general, all of the population, the importance of all these policy recommendations and the importance of health all around. So with regard to connectedness, both groups who presented on HIV/AIDS talk about stigma that cuts across society, whether it's high earning AMS, middle earning, or low earning AMS. So given that stigma is something that is common feature related to HIV/AIDS, the next question that is posed online is, what is your recommendation so that the management of this stigma is shared among the different AMS, given that there is a diversity in terms of social, cultural, and economic standing of the various AMS's countries today? Okay. Any one of the groups may start answering the question.
Hello. So, one recommendation that all AMS can actually apply, since we have different cultures, different histories, we can actually collaborate or like try to implement what Singapore tried to do with their empowered teenagers. And this is to highlight the educational institutions, since if we're able to start young or start with the youth, they're able to implement and bring their values in regards to discrimination and stigma against HIV and AIDS. So, educational institutions who can make IAC campaigns mandatory and engaging for students may consider expanding interactive seminars on HIV symptom identification and destigmatizing HIV misconception.
Okay, thank you very much. Anything from your end, Beth?
So, in addition to what the other group said, I actually agree with their point on how it's important to start young and how the education and the educational institutions are really the best place to start and have this sort of discussion. And in addition to that, I think it's also important um, for these countries to really look into how formalization of sex education can be done, since there really is still a sort of stigma and a taboo about discussing these within places like these. And it's only within more progressive countries or within countries that have opened up towards the issue that have actually incorporated these into their systems. So I think that's another point for discussion, and it would take a lot of openness towards the issue, of course. And yeah, I think that would be my point in addition to what they mentioned. Thank you.
Okay. So, is there any question from the members of the class who are on site? So you may use any of the mics that are strategically located in the room. Okay.
Hi guys. Contract. Okay. Yeah. I actually resonate with Anastasia's concern over the balancing of the profit and the social factors with regards with the with regards with the implementation of UHC among AMS. I noticed lang that you guys have focused. I understand that you have focused on the utilization of the private sector in funding the implementation of UHC. But have you guys considered other sources of funding? Of course, we've established the what you call this, the vital role of the private sector, right? But looking at the appropriations, for example, is it UHC naturally on the budget of the government?
Yes, that's correct. UHD really does naturally fall under the government. And it was mentioned earlier in the presentation that while holistic and comprehensive investment portfolios from the private sector might help lead us to making greater strides at UHD, not all of meaningful change can come from them. It's not sustainable in that sense. And so there is still a need for government budget restructuring and ensuring that the money is going the right places and things of that. So the government does still play a very important role in carrying out.
There's still actually another question from the reactor of the group, Miss Anastasia. He was actually asking the group whether it is possible to consider a more seamless UHC that is shared by the AMS. So for example, you're a citizen of the Philippines and you go to another country, if I understand her comment correctly, would it be possible, based on your review of the policy, to have something like healthcare access if you're visiting other AMS countries? This is actually a question posed to the group to the group of Danica.
I think that paints a very
a vision that I think AMS would like to attain. But I think for now, it highlights the fundamental problem that the healthcare that's provided across ASEAN countries are very uneven. And so it becomes kind of unfair to certain countries if if citizens can go to other countries to provide or to access the healthcare, then countries will flock to particular countries that have a greater quality of healthcare. And so I think for greater collaboration, which could be the goal of the ASEAN region, there needs to first we have to look internally across within our countries first to understand how can we improve our funding, the way we carry it out, the way we execute it, until we reach that point where maybe we can look into deeper programs for collaboration.
Okay. Thank you very much. Okay. Any more question from the members of the class? Yes, please approach the mic.
Good afternoon, everyone. So my question will be addressed the group that discussed the universal healthcare coverage. So, how are we going to compel or encourage the private sector to comprehensively invest in the healthcare system or invest at all? So, will the group recommend incentivization such as tax breaks or tax incentives, or will the group encourage stronger regulatory measures by the state? For example, here in the Philippines, there are advocates who are lobbying for sin tax reform, wherein they will compel companies such as tobacco and beverages to provide more tax that will be invested to the funding of the UH. So what will the group recommend? Thank you.
I think for one, an interesting trend to look into, given the context of business landscapes in general, is CSR has been something that's been very well or very evident and present in recent years. And I think to expand this idea of CSR, that's not just environmental, but something that can be poured into education or medical or healthcare provisions. That's more not really a policy, but something you can help businesses further understand. That's kind of aligned with or that compounds with the idea that providing better healthcare means greater economic results. Fundamentally, if we work under that assumption, but I think for policies, it's important to streamline and institutionalize certain things to make sure that money that is invested is going somewhere resourceful. I am not super familiar with, the whole notion and implications of tax break and things of that nature. I think that's something that we can leave government and those who really know that side. But I think on helping business understand the context of what it means to invest in healthcare is a big first step because again, a lot of businesses have been looking at different CSR initiatives and programs that they can invest to begin with.
Thank you very much. And then there's one last question. I think we just have a space for one last question. This is still again on the stigma, asking the both groups if there's just one program that you would advocate. Can you please tell us more about the content of this program so that it would directly address or redirect or erode the stigma that is still very much attached to people infected with HIV/AIDS. So can you please just talk about what you visualize should be the content of this education program or the IEC material? So education maybe can be answered by Beth, and the other group can answer about the specific content of the IEC, which you believe is strong enough to overturn, the stigmatization that is attached to the HIV/AIDS problem.
Hello. For that, I think one possible way we could look into how we can bring and erode stigma against HIV in general would be through media. I think that media is very important in the sense that it helps us digest things much more easily. It brings things to our attention that we often aren't very open to if it's just discussed in more mundane settings like this. And I think that one reason why I looked into HIV education in particular was because I was able to watch this one performance back in my freshman year. It was something that it was introduced by my Filipino teacher, and it was talking about HIV/AIDS, and it was just trying to clear up the discrimination and stigma towards the people there, and trying to give some context about the stories of these people. And it was based off of the real life stories of people with HIV in general. And I think that that point realize how important and how effective it actually is in convincing you and just giving you more of a background when it comes to these things. And I also heard and I also believe that it's important for us to make use of this sort of um, mode of communication, given that we as human beings, we're more inclined to listen to stories. We're more convinced once we have more context, understand things from a bigger perspective. So with that, I think that media is a very good tool when it comes to addressing stigma in general. Thank you.
Yes, indeed. Media is a very powerful tool for good or for bad. Okay, so second group.
Hello. So I guess to add to this, I would like to talk about on a regional scale, since it was discussed about media, which I'll discuss also in a while. But in a regional scale, the AMS can hold other accountable by preparing conferences and scheduled progress, such as this conference right now.
Yes.
So by discussing what worked and what did not, they may come together to align on standard metrics to follow in order to better track their achievements in relation to the other AMS. But aside from this, if we're going to look at it in a smaller scale or in a country-specific scale, we could focus on what was before in social media campaigns, and to add to starting on the youth, since I'm pretty sure everyone else is in social media now. I think it would be good to have publication materials, or like to raise awareness to everyone, and to stop this stigma and discrimination against HIV and AIDS.
So with that, I would like to thank all the paper presenters. I know it's difficult given your full load this semester, but I hope this will just be the start of your engagement with the other ASEAN member states, and you continue your interest, your research, and also your engagements with other ASEAN member states. Thank you very much to all our paper presenters from the Philippines side. I would now like to turn over, to Father Ramon Natres, Lecturer of Philosophy from Widya Mandala, Surabaya Catholic School, to moderate, the Indonesian, the Widya Mandala side of the conference. Okay, to you, Father Ramon.
Okay. Thank you very much. Could I be heard well? I hope I can be heard well. Good afternoon, everyone, and please allow me to introduce our student presenters from the Widya Mandala Catholic University. The first one is going to be Joseph Tandewijaya. Second one is Ricky Adityanto. And the third one is Franciscus Ivan Andika. We come from the Faculty of Philosophy, so the focus of the discussion will be more of seeing everything from the point of view of philosophy and sharing what we have in Indonesia. So I call on the first presenter. Our first presenter is Joseph Tandewijaya. Joseph will present his paper entitled Surviving the COVID-19 Pandemic Through the Spirit of the Pancasila and Bhinneka Tunggal Ika, a reflection on the Indonesian ideology and motto. Joseph, so you may start your presentation. You turn on your microphone. Cannot be heard.
You hear me?
Yes, I can hear you now.
Good afternoon. Magandang hapon. Selamat siang. In this opportunity, I will present my paper with title Surviving from COVID-19 with the Spirit of Pancasila and Bhinneka Tunggal Ika. To begin with, I would like to present data from the official World Health Organization website regarding COVID-19. As you all can see on the screen, there are around 234 countries and around 615 million have been confirmed COVID-19. And there have been 6.5 million people who died. In Indonesia alone, there is 6 million people have been confirmed COVID, and 160,000 people have been declared dead. This data does not include people who are not detected by the government. The victims are not only those who are confirmed and died because of the pandemic, but also people who are suffer from it. In the midst of the chaos and cruelty of COVID-19, Indonesia can still survive. As a country with the fourth largest population in the world, Indonesia is successful in suppressing the spread of COVID-19 with a confirmed number of no more than 3% of the total population and with a cure percentage reaching 97%. All of this success are inseparable from the spirit of Indonesian ideology, Pancasila, and from the nation's motto, Bhinneka Tunggal Ika. First, we will talk about Pancasila. When you look on the screen, that is the symbol of Indonesia, Garuda Pancasila. And on its chest, there is Pancasila. Panca means five, and Sila means the principle. So it has five main principles on it. The first one is belief in the Almighty God. Second, just and civilized humanity. The third, unity of Indonesia. The fourth, citizens led by collective wisdom in representation. And the fifth, social justice for all Indonesian people. The first sila, belief in the Almighty God, states the existence of religions and its important function for every believer. For Indonesia, religion is one of the eggs that plays a big role in handling COVID-19, but it certainly makes a double-edged sword. For example, at the beginning of vaccination, there were several religious groups that rejected the vaccines, using the pretext of religions, dragging their followers not to accept the vaccines. But on the other hand, there were also religious groups that voiced the importance of vaccines and even encouraged their followers to obey the government and receive the vaccine. The next sila is just and civilized humanity. It provides a reference to the ideal relationships between nations or between countries. The relationship must be based on humanity, respect for human being, for respect for human rights without exceptions. During the COVID-19 pandemic, humanity issues have become one of the highlights that challenge everyone. The COVID-19 pandemic forced everyone to realize that health problems are not only individual, but also a common problem as fellow human beings. Indonesia tries to not leave anyone in a terrible and dying condition, but to help them and prioritize the humanity. The third sila, the unity of Indonesia, is a principle to unite all the diversity that exists in the country of Indonesia. This unity is one of the main reasons Indonesia can survive the pandemic. COVID-19 is no longer an individual problem, but a common problem that must be resolved together. All the people, without exceptions, should help each other and participate for as a common unit. A concrete example can be seen from the program Kampung Tangguh, a place where every citizen tries their best to help and care for each other, regardless of the difference. The fourth sila of Pancasila, the citizens led by collective wisdom in representation. It states that the highest holder of power in the Indonesian state is the Indonesian people. COVID-19 forced the government to take quick steps to deal with it, such as restriction of mobilization, implementation of health protocols, and various other policies. However, the role to implement the fourth sila doesn't only lie with the government, but also with the people. They do not only carry out policies for their own sake, but by genuinely trying to bring Indonesia free from COVID-19. The fifth sila in Pancasila, social justice for all Indonesian people. It is the goal of Indonesia. It means that every Indonesian citizen needs to be treated equally, regardless of their gender, of their ethnic, race, or position. During the COVID-19, Indonesia has tried to keep the welfare of its citizens with various assistance programs and mutual care. It can be seen in Indonesian programs such as BPJS, the National Health Insurance Service, Halodoc, direct cash assistance, and also basic food assistance to the community. Not only the government, but the community also take part in it, especially to those who need more help. I think that's enough for the Pancasila. Now we will see the motto of Indonesia. Indonesia has at least 300 ethnies, 1,340 tribes, and 650 different states that settled in more than 17,000 islands. So, how Indonesia, a country with the fourth of the most population in the world, can unite? One of the answers is Bhinneka Tunggal Ika. When you look again to Garuda Pancasila, the symbol of Indonesia, you can see that the Garuda is holding a ribbon titled Bhinneka Tunggal Ika. Bhinneka Tunggal Ika can be interpreted as unite in diversity, a motto to describe the unity that has values such as tolerance, moderation, harmony, cooperation, and brotherhood. Bhinneka Tunggal Ika is the greatest implementation of the value of Pancasila. The sense of unity in diversity is the basis for a common struggle in society to jointly release Indonesia to achieve freedom from COVID-19. If the people can unite, the programs that have been planned will be never succeed. In the end of my presentation, I want to state that Pancasila and Bhinneka Tunggal Ika is a spirit that has existed in Indonesian society since long ago and has been taught since the founding of Indonesia. The spirit encouraged Indonesia to rethink its unity, a unity in diversity, a common struggle for the common, but it will be in vain if the spirit is only buried and dead in the minds and memories. The COVID-19 awakens the Indonesian people to a spirit that unites. To Pancasila, which is the ideology of Indonesia, and to Bhinneka Tunggal Ika, which is the motto in living together. It is not an easy task, and it must take help from all Indonesian people to achieve it. But in fact, Indonesia still has many things to be improved. Many things must be fixed, but we need to emphasize that Indonesia already has at least two extraordinary spirits, Pancasila and Bhinneka Tunggal Ika, the spirits that help Indonesia to survive in facing the COVID-19. Thank you.
Thank you very much, Joseph. Our next presenter is Ricky Adidianto. The title of his paper is The Resilient Village Program's Role in Indonesia's Success in Facing the Pandemic, assessed from the point of view of Carol Wojtyła's participation theory. So please welcome Ricky Adidianto. You may start your presentation, Ricky.
Selamat siang, magandang hapon. Good afternoon, everyone. I'm Ricky Adidianto from Widya Mandala, Surabaya Catholic University from Indonesia. And today, I'll present my presentation, Resilient Village Program's Success in Indonesia from Carol Wojtyła Participation Theory. Let's see the first part of the presentation title. It is Resilient Village Program's Success. But what is this success that this success becomes so important and so big here? This infographic shows the effectivity of resilience village in East Java. Let's focus on the 1st June 2020. The recovery rate here is only 14%. It is before Resilient Village program was implemented. And then to the bottom, in August 2020, after Resilient Village program was fully implemented, the recovery rate becomes 77%. That means the recovery rate increased as more than 5 times in only 2 months. So the question here, how? How could Resilient Village do that? But before that, I'll give you one better question. What? What is Resilient Village program? Resilient Village program, or we call it in Indonesia, program Kampung Tangguh, is a collaborative program that includes active community participation in village scale to mitigate COVID-19 pandemic effect. And the goal to develop the ability to set and self-reliance in community to solve problems in their environment, especially those related to the COVID-19 pandemic. Resilient Village program use SARA method, which is scanning, collecting data, and problem identification, analyze the source of the problem, response, determining solution and its alternative, and how to implement it, and the last one, assessment, evaluation, and how to improve. It all to reach the goal that is self-reliant community. The first step of Resilient Village program is knowing the problem. We have to collect the data about existing infrastructure, such as village hall, mosque, or other infrastructure, and then resident demographic and affected residents, and last one is village map. All this data become the basis for the community development, that is these 7 pillars. The first one is human resource. We do it through local leadership training and developing village management system. And the second, security, through creating village security unit. In Indonesia, like in this picture, we have post tumbling or village security post that run by the residents itself. And also creating security problem solving flow. The third one, information, through utilizing existing village infrastructure and technology, both analog and digital, to share village health information. For example, by utilizing local radio, like in this picture, WhatsApp group, or bulletin board in village hall. The first one is logistic, by creating village food bar that's filled voluntarily by the residents to cross-subsidize affected residents. We can also create village saving, technology center, and supporting village small business. The fifth one is health, by giving health training and manual, such as first aid manual, quarantine manual, and COVID-19 corpse handling training. The sixth is psychology, by creating forum for community sharing and support, for example, through Zoom, like this picture. And the last one, culture, by making all the pillars a sustainable habit so that they become a local culture. In all the 7 pillars, its residents were given specific role according to their ability. This makes them feel to be a part of society with name and role. They become the driving force of the Resilience Village program. So, The next question is why? We already know the whole know why Resilient Village program was so successful. So let's go to the second part of the title, Carol Wojtyła's participation theory. So what is this fancy terms means? So according to Carol Wojtyła or Saint John Paul II, to understand what is participation, we have to understand these two sides of human act, the personal dimension of human action and the intersubjective dimension of human experience. The personal dimension of human action is about me, it's about you, it's about of each person. It is me who is the source and the cause of my own action or actus humanus. I also show myself through my action. For example, it is normal for me as a musician to play music to show that I am a musician. And I also experience the value of my action through doing it. As a musician, I can master a violin through I'm doing the act of playing violin repeatedly. Through this, I achieve self-fulfillment. And then the intersubjective dimension of human experience. So how I interact with the other. I experience you and you experience my action. This brings us to I-go relationship, I-you relationships. And since we live in a community with a lot of I-go relationship, this brings us to we relationship. In this we relationship, we coexist. I live with and because of others. And coacting, we act and interact together with others. And together, we achieve common good. So in summary, participation is when I express myself and my coexist and coacting with others in community to fulfill myself and together we achieve a common good. So what about Resilience Village program? From Sarah method and the 7 pillars, we can see the movement from data to a person as someone who acts. Then from a person, he is invited to act not only for himself, but also for his community. To go act with his community. This is a very essence of participation. Meanwhile, in physical distancing, we can see the very opposite of that, from human to data. In physical distancing, what people do will only be regarded as data and affect only the data that do not directly affect them. People are being separated from the effect and value of their action and the others. This separation experience in physical distancing is referred by Carol Wojtyła as alienation. This is the reason why physical distancing fails from the perspective of personalism. While the Resilient Village program creates solidarity thanks to participation. So, how about Southeast Asia? Considering Southeast Asia's communal spirit, Resilient Village program has an opportunity to be applied in Southeast Asia as a way to address challenges in difficult areas in Southeast Asia. And in the Philippine context, based on the Harvard Humanitarians Initiative Resilient Communities Program Symposium for Marginalized Communities on March 2022, it was concluded that there are 4 efforts needed to support people in vulnerable communities, which are effective communication and coordination, collaboration in information sharing, local leadership, and last one, adaptation and resilience, which consists of thriving household business and locally led efforts. These are actually already included in the 7 pillars of Resilience Village program. And also, there are 4 steps needed, which are addressing the mental health, contextualization, importance of research, and then engagement. Again, these are already included in Resilient Village program's SARA method. So, in conclusion, Resilient Village program also has potential to be implemented in Southeast Asia. And the conclusion, participation is important. Participation is important in policy making, especially in health sector. Participation ensures us, you and I, to stay a person with name and action, and not merely nameless number of data. We are person, not data. We have right to act and participate for our community because we are human, not a number that affects another number or just a mathematical equation. And Resilience Village program is a good example of participation-based program. Thank you.
Thank you very much, Ricky. Last but not least, we have Franciscus Ivan Andika. He will present his paper on the influence of telemedicine development on information, understanding, and access to public health. You have the floor, Ivan. You may start your presentation.
Okay, selamat siang, magandang hapon, good afternoon, everyone. My name is Ivan. I will be presenting my essays entitled The Effect of Telemedicine Development, Understanding Information, and Access to Health in the Community. As we know, the development of digital technology, seen by use of Internet of Things, artificial intelligence, robotics, and big data, bring change to people's life. Through the use of technology, humans have to hope to be able to find solutions to social problems that are being faced. This is the main goal of the era initiated by Japan, known as the Society 5.0 concept. Concept of Society 5.0 is extensive in the realizations of those combinations of science space and physical space to produce quality data stored information storage devices. Data from the real world is collected and analyzed in digital space to find workable solutions. The role of technology has become increasingly central during the COVID-19 pandemic, along with restrictions of human movement and restrictions of physical contact. During the pandemic, telemedicine has an important role to play in seeking access to health amidst various restrictions. Telemedicine itself is a health practice that combines audio-visual and data communications, including diagnosis, consultations, drug prescriptions, medical data exchange, and remote scientific discussions. Now, I will explain the big picture of healthcare in Indonesia. According to the Central Statistics Agency, September 2020, Indonesian population reached 270 million people. Data from Katadata.co.id shows that Indonesia ranks second lowest in Southeast Asia in the ratio of doctors availability when compared to population health needs. In addition, Indonesia also has problems in the even distributions of health workers. Availability of doctors or other health workers can be said is still centered in island of Java and big cities in general. Now, how about telemedicine in Indonesia? Data from Asosiasi Penyelenggara Jasa Internet Indonesia shows that there are 170 million internet users in Indonesia, and it's still growing. Telemedicine itself has a broad scope that includes the provision of remote health services through the transfer of information using smartphone, involving doctors, patients, and other parties. In simple terms, telemedicine is already practiced when doctor and patients discuss health issues over the phone. Innovations in telemedicine are now being seen through mobile health or mHealth that allow technology to be utilized to provide a space for patients' engagement with doctors, as well as being able to improve healthcare provider communications. During the high spread of COVID-19 cases, there was a fear in the community to go to the hospital and meet the doctor in person. In Indonesia, this fear has led an increase in the use of mHealth applications to find information about health. In Indonesia, 51% of mHealth users utilize their apps to search for health-related information. Indonesia health apps are quite diverse with many startups emerging, one of which is Halodoc. Halodoc is an app founded by Jonathan Siddhartha in 2016 through mHealth Tech. Some of features in Halodoc are order medicines, doctor consultations, vaccinations, make a doctor appointment, laboratory check at home, and updated health info. Halodoc itself is affiliated with Gojek Indonesia, Astra International Group, and Telkomsel. According to Halodoc Chief Business Officer and co-founder, Dodi Lukito, in 2021, Halodoc has been supported by partners as many as 20,000 doctor partners, 4,000 drugstore partners, pharmacies, and 2,000 health facilities connected to the Halodoc platform. In online, Halodoc conduct marketing activities through social media, such as Instagram, YouTube, Facebook, Twitter, TikTok, and etc. Content provided is quite diverse, ranging from information about health, product, as well as promos and marketing campaigns for Halodoc in the form of images, moving images, videos, and etc. As we know, there are advantages and disadvantages of using telemedicine. According to the American Academy of Family Physicians, consultations with doctors can help patients get information about suspected diagnosis, course treatment or treatments for illness or injury cases, and tips on improving health. Telemedicine support clinical care is a solution to distance and geographical factors. It's an innovation in information technology and improve quality of life and health of the wider community. In the Halodoc apps, there is a feature that allows people to send a direct chat with a trusted doctor anytime and anywhere. Articles as health issues and educational content can also be easily accessed by the public. It's enabled one important target point of telemedicine, which is to overcome anxiety in patients and avoid the upward effect of self-diagnosis on patients. In addition, there are also the advantages of telemedicine, such as at most doctors can only provide possible diagnosis accompanied by other comparisons because of doctor cannot examine patients directly. Telemedicine, in this case, less suitable for patients who have specific or severe diseases. So patients will tend to want to get direct treatment from experts. Then I have a suggestion for Halodoc. So that Halodoc, which has been collaborating with the government through the Peduli Lindungi applications, can also add data on BPJS health insurance services so that people with low income can also access health properly. Halodoc itself must also be able to maintain public trust by improving service quality, such as timeliness of drug delivery, doctor availability, and also promoting through its various social media. Thank you for your attention. Today, maybe we stay healthy.
Thank you very much, Ivan. And now we are privileged to have Dr. Diana J. Mendoza, coordinator of the Ateneo Initiatives for Southeast Asian Studies and assistant professor of the Department of Political Science, Ateneo de Manila University, Philippines. She will serve as our panel reactor. So Dr. Diana, you have 15 minutes for your reaction to the Indonesian students' presentations. The floor is yours.
Thank you, Father Mon. Good afternoon, everyone, here at Escalar Hall at Ateneo de Manila University. Good afternoon also to our colleagues and friends at Widya Mandala, joining us, of course, online via Zoom. When the World Health Organization declared the COVID-19 outbreak as a pandemic on March 11, 2020, an outbreak of anti-China and anti-Chinese hatred and revulsion flooded cyberspace. And this happened along with an outbreak of moral panic in almost every part of the world. The outbreak of moral panic resulted in people's increased feelings of fear and anxiety, exacerbated by feelings of lack of protection and certainty. As we have all witnessed, the COVID-19 pandemic revealed not only the increased vulnerabilities of states, both those with weak public health infrastructures and otherwise. The COVID-19 pandemic also intensified citizens and media's increased demand for transparency and accountability from their governments, in spite of governments' increased call for tolerance and calm from citizens and media. What we have also witnessed over the past 2.5 years are the innovative, creative ways peoples and governments have undertaken to address the COVID-19 pandemic. All the 3 papers presented by our dear students from Widya Mandala examine the various challenges and opportunities brought about by the COVID-19 pandemic in Indonesia. Joseph on how Pancasila values are reinforced by the COVID-19 pandemic, Ricky on the positive impact of Resilient Village program to combat the spread and impact of COVID-19, and Francisco's Ivan on digital health technology, particularly telemedicine, to democratize and facilitate access to health information and health services in Indonesia. For the first paper by Joseph, Joseph talked about the relative success of Indonesia in suppressing the spread of COVID-19. He argued that the success can be attributed to the Indonesian state's ideology, Pancasila, and the country's national motto, Bhinneka Tunggal Ika, or unity in diversity. What Joseph emphasized in his paper is how Pancasila values are reinforced in the government's policy response and much more in the people's actions and behavior during this pandemic. These values are based on the 5 principles: belief in the Almighty God, civilized humanity, national unity, deliberative democracy, and social justice. Joseph also pointed to how Indonesia's national motto of Bhinneka Tunggal Ika, or unity in diversity, reinforces the feeling of solidarity, of oneness, many yet one, of Indonesianness, in spite of the significant cultural, ethnic, religious, and linguistic diversities in the country amid the crisis brought about by the pandemic. If there's something that stands out in Joseph's paper, is the emphasis on culture and ideology, and the role this play in shaping people's behavior when under threat or in a crisis like COVID-19 pandemic. As argued by Joseph, the Pancasila values kicked in even stronger during the pandemic, shaping how Indonesians act and behave. The need for overarching safety and reassurance prompted people to revert to the uptake of established Pancasila norms and values that have in the past helped them to overcome such times. So if there's something that I would wish to be developed in the paper, and maybe later Joseph can also give his opinion or insight on this matter, is the inclusion of those actions or behaviors that assert one's individual autonomy from the state ideology. Joseph, for instance, used an example of vaccine hesitancy in his paper and the tensions among religious groups in Indonesia over vaccination. So despite the general requirement of a monotheistic faith to fulfill the first principle of Pancasila, the Indonesian government recognizes 6 religions as part of the Indonesian nation. You have Islam, Catholicism, Protestantism, Buddhism, Hinduism, and Confucianism. So it would make us an additional contribution if the paper would also look into these expressions of resistance and defense of individual autonomy from the state ideology. Ricky looked into the positive impact of resilient village programs that emphasize active participation and cooperation of members of a village or a community. Such programs, according to Ricky, contribute to the village's higher resiliency and faster recovery from COVID-19. In his paper, Ricky offered the Resilient Village Program as an alternative to physical distancing measures which receive passive conformity from people and cause feelings of alienation among individuals. Resilient Village Program is a collaborative program that includes active community participation in its implementation, starting from problem analysis, problem response actions to evaluation. The goal is for the community to have the ability and self-reliance to solve problems in their environment, especially those related to the COVID-19 pandemic. The concept of resilient village in Indonesia was made as an alternative reference for the prevention of COVID-19 at the community or village level. A resilient village, therefore, was an effort to strengthen action against COVID-19 that is easily carried out independently by the community. Guided by Pope John Paul's theory of participation, Ricky analyzed how Resilient Village Program embodies participation as a property of the person as well as an ability to share in the humanity of others. Through the Resilient Village Program, individuals experience themselves existing and acting together with others, but they experience this in a whole new dimension. They not only experience their coexistence and co-acting, but also experience their unity. So I took those insights from Dean Edward Mejo's reading of Pope John Paul's theory of participation. What stands out about Resilient Village Program in Indonesia is its participatory policy approach and design. Participation is not taken as a token empowerment tool. Rather, it advances democratic principles of inclusion and deliberation, aimed at co-creation, co-production, and co-design. The Resilient Village Program fosters more effective and legitimate inclusion of communities in decision-making that directly affects their lives. Again, for Ricky, maybe your thoughts as well later, a discussion of how such participatory approach and design of Resilient Village program contend with long-standing political structures that privilege elites more than the citizens it seeks to serve will be a good discussion as well in the paper. And finally, the paper by Ivan. Ivan discussed how the Indonesian government turned to telemedicine to help combat the COVID-19 crisis. Telemedicine was undertaken as an alternate solution to problems caused by limited supplies and facilities to treat COVID-19 patients. Through the use of telecommunications, the World Health Organization refers to telemedicine as telehealth and defines telehealth as the delivery of healthcare services where patients and providers are separated by distance. Telemedicine, or the use of telecommunications technology to deliver medical care to patients in need, is a viable and accessible solution to overloaded and overwhelmed health systems and infrastructures. As in the case of Indonesia, as observed by Ivan, telemedicine or telehealth can not only help in fighting against COVID-19, but also in improving day-to-day hospital systems and processes. Telemedicine provides a safe, efficient, and effective solution that addresses the needs of patients and the health system. Regarding telemedicine, it is important to note that the implementation of telehealth within the overall healthcare system, especially with the differences in the country's needs, cultures, and digital understanding, remains a complex task in Indonesia. So maybe later, Ivan can also react on this observation. The paper can be developed to include how Indonesia managed the implementation challenges and barriers to patient adoption of app-based consultations and telehealth services for lessons or replication of resource-limited settings such as in the Philippines. How is telemedicine informed by the current political and economic climate of healthcare? Or a question like, who owns the means of healthcare production? Also, to address an emerging concern about the lack of clear laws to regulate telehealth or telemedicine industry or business. Doing so, telemedicine or telehealth can indeed be an effective and efficient component of healthcare systems and infrastructures, and not just an alternate solution to COVID-19 and health systems problems. I end here, and I thank our three student presenters from Widya Mandala for their active participation and meaningful contribution to this afternoon's conference. Thank you. Salamat. Terima kasih.
Thank you very much, Dr. Diana. Now I would like to open the floor for questions and comments regarding the students' presentations. Dr. Diana herself had already presented some questions that maybe our panelists can already try to answer. First one was for Joseph in the Indonesian actions and behaviors. So regarding the Pancasila, what about autonomy? So, I mean, you're working together in Bhinneka Tunggal Ika, you're having everyone work in the same, going in the same way, but what if there are objections? What if there are people who don't want to follow that way of the other people? What could you say about that? What about, how can you balance that with autonomy? Yes, Joseph?
Yes, thank you, Kai. The first one, it can be denied that the Pancasila and Bhinneka Tunggal Ika can be implemented, fully implemented in the Indonesian people. It makes many difficult for our country to realize it, and there is so many problems because of the diversity, because of the a lot of people that are struggling uh, to prioritize their own sake. So how can Pancasila and Bhinneka Tunggal Ika can be implemented? It can be answered for the concrete program, but it must be for the first time we must know what's the meaning of the Pancasila itself or the Bhinneka Tunggal Ika, that we must be unite in the diversity, that must be we must unite regardless for our difference, because Indonesia have many ethnics, have many tribes, and have many islands that makes it more difficult. But one must be emphasized that Indonesia, from the beginning, for the foundation, it has been taught for the people to unite in diversity. And I can't give the concrete answer, because for Indonesia itself, we still struggling to make it happen for the reality. I think that's my answer, because it's the ideology, so it's about the ideal system that Indonesia must be taken for. But as for implemented, we Indonesia has been makes many programs to realize it, such as Kampung Tangguh, or the BPJS, that makes Indonesia have national insurance programs that uh, that the Indonesia want to realize it, want to realize the ideology, the Pancasila, and want to make Indonesia unite in the diversity, like Bhinneka Tunggal Ika. I think that's enough. Thank you.
Okay. Thank you very much, Joseph. So you mean that it's in the process of implementation, right? So we are continuously trying to disseminate it. Everyone has to memorize the Pancasila. Everybody has to be able to recite it, etc. So in that process, I think that's where we're putting faith in. And I think the question for Ricky was in the discussion of participation. So what about the future? How can you make this continue, this participatory mode of making decisions? And will not in the end, won't it give privilege to those who are richer and powerful in the end, and not really be participatory? So how do you make that continue? Okay, would you like to answer that question, Ricky?
Okay, for how to make it a continuous program. Actually, we in Indonesia already implement the spirit of Resilient Village program itself from even before the COVID-19 pandemic. Such as in security, actually we already have post-family or village security unit. And for logistic, some village actually already have village food barn, and in people in the village itself already have spirits to help one each other. And also if we say about in health sector, every village already have a posyandu, so health center in its village. So it's actually already they implemented the spirit of resilient village program actually already there even before COVID-19 pandemic, but it will become even more concrete since COVID-19 pandemic with resilient village program. So actually I'm optimized if resident people in villages feel the positive impact of the concrete of resilient village program, they will continue it, because if we see the 7 pillar itself, it's actually not only beneficial in COVID-19 pandemic, but also in our daily life, like in logistics. Like we don't know when we will have cancer, perhaps, or maybe a natural disaster. We don't know. But with logistic development, we can mitigate the effect of natural disaster, in example. So yeah, it can be a continuous program. But then how about the richer group of people who are not really in participation in this program? Yeah, actually, the target of Resilience Village program is the people in the village itself. So that means, yeah, it is more effective in a small scale, in village area, than in an urban or city area. So that means, yeah, it's very effective to the target actually for people in vulnerable group, people in vulnerable community. That means to help people who are jobless, who are affected by COVID-19. But then, yeah, if we see in city area, it's actually rather hard to implement resident village area, because, yeah, like we see in Surabaya, for example, with apartment, with city blocks, actually people have less and less contact with each other. So yeah, it needs a great challenge in city area. So I think we need another kind of resilient village program in city, maybe a resilient city program. But how to implement it, how the concrete is, yeah, we need to create another thing, because in resilient village program, it is from the spirit of the village people, but the city people have a different way of life and maybe also different spirit. So we have to contextualize this program into city area if we want to implement it in city area. But if we can implement it in city area, actually it has a huge potential. For example, if we can create not only just village saving, but city saving, like a one saving from rich people that feel voluntary by rich people in city, and uses to subsidize not only for the people in the city, but people in the village. It actually has a very, very huge potential to help people in the village. But yeah, and then we need to understand the spirit and the way of life people in the city. But perhaps, I guess, how to improve, how to invite city people to create something like a resilient city. I think, especially in Indonesia, the way is through religion, through the religion public figure, like the priest, the Hajj, the Kiai, the ulama of Islam, perhaps, or the Buddha, the Buddhist, from the Buddhist. We can ask that religion public figure to invite city people to join this kind of program. Because, yeah, again, in Indonesia, the biggest motor, the biggest driving force is actually religion. So I think the way to enter the people in the city, aside from understanding their way of life there and their spirit, is also through religion. So I think that's the point, how to make it continuous and how to make it implement in city area, especially in a richer people in city area. That's for me. Thank you.
Okay, thank you very much, Ricky. So you mean that actually the attitude was already there at the very beginning, and it is like an implementation of the Panchasila, right? In the village setting, and the actual target is to redistribute justice and to help those who are less privileged in the villages, right?
Yes.
Okay. Now for Ivan, So the question for Dr. Diana was, what about implementation? Are there challenges in the implementation of telemedicine, Halodoc, for example? And yeah, there's a question of who owns the means, right? So who is the one handling it? And then what are the laws that should regulate this, etc.? These are the questions. And on the chat box, there's a question about data privacy. So are there concerns of data privacy when you use Halodoc? And then what are the policies of Indonesia in regulating the use of these apps? Okay, so could you answer those questions?
Yes, first, thank you for Dr. Dan for the questions and feedback to develop my writing. As we know, Indonesia has more than 17,000 islands and a large population. So it needs a challenge for telemedicine in Indonesia to manage how the internet infrastructure can develop well. According to data in grandviewresearch.com, shows that the growth of telemedicine will grow 4 times in 2028 compared to 2020 in Indonesia. During the pandemic, the development of telemedicine itself cannot be separated from the growth of e-commerce in Indonesia. Indonesia itself has high growth of the e-commerce sectors since the pandemic. Many people in Indonesia has begun to get used to using a wallet. Then telemedicine itself as a startup include of e-commerce itself can be implemented in Indonesia. And then for the next question about data and etc. We in Indonesia have a ITE law that protect IT. Then ITE law, yes, there is can to overcome the obstacles and also various bad things about the telemedicine business and all of the IT sectors in Indonesia. It's about data privacy. We are in Indonesia still struggling of this. We still have problems like, as you know, it's about Biorka and etc. So this is the struggle of government to protect data in the people of Indonesia. This is my reaction. Thank you for it.
Okay, good. So you mean that there's already some things in place, right? And that, yeah, indeed, with Indonesia, with being such a big country, there's a real need for the telemedicine, even though it may have its imperfections. Okay. So I would like to open the floor for anyone who would go to the microphone, from those who are in the theaters, in the auditoriums. Is there anyone who would like to ask a question from there, from Ateneo or from Widya Mandala? You can come forward and use the microphone. If there's none, there's a question here from Dr. Dennis. So how did the coping experience with COVID-19 pandemic affect the Indonesian adaptation capacities to respond to health-related challenges? So is Indonesia better now at facing the challenges of health issues, of health problems? Are we better at that? There is a question that comes to my mind in connection to the emphasis on HIV in the Philippines as well, which we did not tackle because there's also stigma, right? So there's stigma in the Philippines, but I think in Indonesia there's even more stigma. So in things of HIV, etc. So any one of you can answer those questions. Is Indonesia better now? Have we learned how to face health problems? And do we know how to cope with stigma, which are like a limitation in our able to respond to health problems? Any one of the speakers?
Okay. For me, actually, from what I also experienced.
Oh, there's one question.
Yeah. Yeah. From me.
Yeah. Is there one question from Widya Mandala?
Yeah. There's also a question.
Is it my connection that's going slow or their connection? Hello? Okay.
There is a question from Widya Mandala.
Okay. Maybe you can open that question as well. Please? We cannot hear him. We cannot hear the question.
Okay. Can you hear me loud and clear?
Yes, clear.
Thank you for the opportunity. I'd like to ask about the telemedicine, okay? The philosophical aspect of telemedicine, okay? My question would be an ontological one. Simply said, what is man if he does this telemedicine thing? Because, of course, through this telemedicine, a man extends his being. No? He extends his essay, his modus essendi, his mode of being. Then, not only that, but this man also entrusts or surrenders his welfare, his well-being to a system, which I think we can agree that the system is not really a being. We can even argue that this system is a non-being then. So what kind of man is this? Will this revolutionize our understanding of man? Okay. One term that comes to my mind was homo digitalis, for example. But can we really be sure that a homo can be digitalis? Meaning, digitalis, it necessitates a binary differentiation. But can a human, a man, can he or she be binarily differentiated? Okay, so again, what is a man? Thank you.
Okay, so panelists, please answer the questions that have been posted. That have been posed to you.
Yes, I will answer the first question about have we learned about from the COVID-19 pandemic, especially after Father Rama's edition about the stigma about, let's say, HIV or COVID-19. My answer is yes and no. Yes, because since with telemedicine, like Halodoc, like what I feel when I was when I got COVID-19, the structure of the health sector in Indonesia has become better because the telemedicine, so the medicine is easier to get. We can get the medicine from our home because we thought we have to go to the apothec or the drugstore. We can ask the doctor through our phone. We thought we have to go to the doctor himself. So I think, yeah, from the health section, from the structure, from the service, it's become improved actually since COVID-19. But from the stigma, I think Indonesian people still have a lot of difficulty against the stigma with people with COVID-19. Yeah, especially in the first year or first and half year, it's very hard because if people got COVID-19, then it's become a bad thing for his family, for his village. Yeah, it's very hard. But then in the second years, especially lately, people become more relaxed actually with COVID-19 pandemic. So from the stigma, it's become lesser and lesser in COVID-19 case. But then people less care about the health protocol. That's why resilience program actually it's pretty good to remind people with the health protocol and how to mitigate the effect of COVID-19 pandemic through like health training and also the through logistic development. But I think about the stigma, yes, people still have difficulties, but now it's become more relaxed. But let's say about the other, like HIV/AIDS, it's still sometimes it's still stigmatized. But that's why I think, especially in HIV/AIDS, people usually choose to make it a secret if they contract HIV because a stigma for the people. But the service for the health service itself is become easier actually lately. So yeah, I think it's yes from the health service, but no if we talk about the stigma of the people. But maybe my friends will add my question.
Thank you. I will add some more data. From the data for the first year and first half, Indonesia have many fear for the COVID-19, and it has been determined that people who suffers from COVID-19, people who confirmed positive will be that will be we make it yeah we isolated it, so we didn't make them like human. We just look for we must judge it, we must judge her or she or him. So there's so much problem in the first or half year, and later on Indonesia study for from this case that Indonesia makes some program for like Kampung Tangguh that makes Indonesia realize that humanity is not the end. Humanity will get stronger because of the COVID-19. And for there's the question too for the telemedicine, I think, because the telemedicine is what is the system? The system is for it for the human itself, and it come from the human. So I think what is man? We can be the man of Homo digitalis. That's for our culture now, because we can't do anything without the technology, right? Right now, what we do now from the Zoom and for the uh, the internet that unite us from afar, and it makes us grow stronger. It's not just about the telecommunication, but it also about the healthy. I think that's maybe if on that.
Thank you. First of all, telemedicine itself is designed as a remote healthcare service, making it particularly useful when there is an emergency response in the environment or an ongoing biological hazard. As you have mentioned that we have a task to contemplate again how humans are integrated through telemedicine. And of course, there are still many disadvantages of telemedicine, one of which is, as you mentioned, but one of disadvantages there are like in publications in ABC Cardiac Journal that doctors cannot examine patients
directly, at most doctors can only provide plausible diagnosis comment by other comparisons. That this is not have it's have can be a problem that doctor just choose a possibility of diagnosis. So doctors cannot directly examine the patients. Yeah. And what about the Homo digitalis? Is like Joseph have said, we have to again to contemplate how humans are interpreted again. This is my answer.
Okay. Yeah, I think that's, well, that answers all the questions that we have been given. And I would like to thank everyone for your active participation in this second set of presentations. Thank you as well for our student presenters. And we hope that the presentations inspire students in our audience right now to produce excellent academic work that we can share in cross-country conversations and collaborative activities such as this conference. We hope to see your presentations in our conference next year. So back to you, Jesse. I will give the floor back to you.
Thank you very much, Father Mon and Doc Leslie. Thank you as well to our student presenters, Beth, Danica, Ino, Ria, Hans, John, Pauline, Miguel, Rafael, and from Indonesia, Ricky, Joseph, and Ivan. Thank you as well to our reactors, Dr. Anastasia, Jessica, and Dr. Diana. To provide the synthesis of the student presentations and discussions, please welcome Dr. Dennis Batangan, lecturer at the Ateneo Initiative for Southeast Asian Studies and research scientist at the Institute of Philippine Culture.
Thank you very much, Ms. Jessie Claudio, and good afternoon, everyone. This is Dr. Dennis Batangan, and as a form synthesis, I would like to highlight some points in the discussion this afternoon. So we had a description of the context of the MOU, and of course, the signing of the MOU by Father Roberto Yap and Dr. Hartanti, Father Roberto Yap of the Ateneo de Manila University and Dr. Hartanti from UK, Universitas Catholic Widya Mandala, Surabaya. Would like to highlight the messages in terms of the confluence of ideas and cultures, which we are starting in this particular activity. A few weeks ago, we had a lecture from Dean Simon Ontara in our class, and it was very heartening to hear the context of ASEAN, people-to-people interaction and connections, connectivity between our two countries, and exactly the context of this conference, health challenges and opportunities in the Philippines and Indonesia. No, I would not go into the details of the presentations, but try to sum up the concerns or the items or the highlights of the discussions. We actually looked at specific programs and policies across the different countries, Indonesia and Philippines and other ASEAN member states, and tried to relate it to the evolving health systems, including universal health care, including the specific related programs on education or IEC, information, education, communication, and somehow look at the contextual factors in terms of the economy, in terms of the culture, in terms of the practices in these particular countries. What's coming out, of course, is that health cannot be seen in isolation with these determinants. As we have been saying in the course, we should look at health, or we understand health from the context of social determinants or the social determinants of health. And we took this afternoon a fresh dive into these issues in the Philippines and Indonesia to explore what are these issues. As you see, the topics have been varied. We didn't really indicate to the students and, of course, the presenters that they should be focusing on certain topics, because that's exactly the point, that we want to explore these issues as they are coming out post-COVID and as an initial experience between our two universities. So we'd like to again thank the student presenters, the faculty who made the feedback and the comments to our students, and we hope that the interaction has been equally fruitful for the students and the faculty, so that we are able to, as Father Ramon said, probably move on and prepare for the next conference, probably with more focus or more definite issues that we would like to discuss. Finally, as we look into these issues, challenges and and expectations, we would like to sort of highlight the fact that the discussion now has been from the School of Social Sciences from Ateneo and the Faculty of Philosophy in Widya Mandala, Surabaya, which I think really puts the context of social determinants of health at the core of the discussions with regards to health issues, not only in the Philippines and Indonesia, but more so in the ASEAN context. So thank you very much to everyone who participated online and on-site, and we hope that the discussion provided you with insights and probably more questions to be able to pursue in your respective academic and professional work and be able to respond to these in due time. So good afternoon, thank you very much, and magandang hapon. Terima kasih.
Thank you very much, Doc Dennis. And now to formally close our program, we would like to call on Dr. Zarina A. Saloma Akpedonu, Dean of the School of Social Sciences, Ateneo de Manila University.
Father Roberto Yap of the Society of Jesus, President of the Ateneo de Manila University, Father Conchoro Fowe, Rector of Universitas Catholic Widya Mandala Surabaya, Dr. Lani Hartanti, Vice Rector of Student Affairs of Universitas Catholic Widya Mandala Surabaya, paper presenters, administrators, faculty, and students of our two universities, good afternoon. I would like to close this event by highlighting the significance of today's event. We did not only formalize the partnership between our two universities with the signing of the Memorandum of Understanding, but proceeded to mark it by embodying the idea through a student conference. The chosen topic, Health Challenges and Opportunities, demonstrates the range of common issues and opportunities that we share together in the region. With our students, we gained nuanced insights into local experiences of the health system and infrastructure in our own countries, as well as institutional and policy responses to HIV/AIDS and COVID-19, while simultaneously drawing from and cutting across bodies of existing research on trends within the Southeast Asian region. Research on another country helps highlight particularities in the Philippines or Indonesian experience, which help us understand our country better. In the School of Social Sciences of the Ateneo de Manila University, we are promoting the problem-solving mode in our practice of the social sciences. In seeking to expose our students to how knowledge is produced, which involves presenting one's ideas and subjecting these to critique and assessment by others, students as conference participants gain a fuller appreciation of their membership in a bigger community of scholars and of the role of the social sciences in providing not only analysis of social issues, but also solutions or practical results. Thank you to our student presenters. My gratitude too to the moderators and discussants, Dr. Leslie Lopez, Ms. Anastasia Susanti, Father Ramon Nadres, Dr. Diana Mendoza, and Dr. Dennis Batangan. Most of all, I reserve the final round of thanks once again to Dr. Diana Mendoza of the Ateneo Initiative for Southeast Asian Studies and Dr. Leslie Lopez of the Development Studies Program for leading our side in this promising partnership with Universitas Katolik Widya Mandala Surabaya. I trust you had a most insightful time at the conference, and I hope to see each other again in the future embodiments and enactments of our new partnership. Thank you.
Thank you, Dean Wopie. Again, thank you to all our student presenters, participants, and panel reactors for the lively and fruitful discussion on regional health concerns. Good afternoon, everyone.
Good afternoon and thank you.
Face up.
Recording stopped.